Hello guys, welcome to my new video. Today I want to discuss the topic. The topic is very important. What is the meconium aspiration in newborn baby? How it is caused and why a death happened due to meconium aspiration. So first of all, we understand that what is a meconium? A meconium is the first stool when baby passed, when newborn baby passed. So it is known as meconium, not a stool. So how it is a life-threatening or dangerous to the newborn baby health? When a newborn baby in the mother womb, so we know that the baby float into the amniotic fluid. The amniotic fluid is a pure, but when baby passed a stool or meconium, then this stool or meconium mixed with the amniotic fluid, so this amniotic fluid baby inhale inside. So then this has become a very dangerous because it contains of a toxicity. We know that the stool have a lot of bacteria and other pathogens. So how it is happened? What is the reason behind this? We talk about that. The reason behind this, if the baby goes into the fetal distress, mean the baby's CTG is a normal, not came in a normal position. Mean abnormal CTG shows that the baby in his fetal distress. We also want to discuss that the baby's ultrasound came not a normal. The other reason is that if the baby delivery not done in a fixed time, mean baby goes into the postpartum period, mean when the baby past a 37 weeks crossed, then if baby goes into the 40 weeks, so it is known as a post delivery. So it means that the baby passed a meconium, then it goes into the inside of baby's mouth, then it become a toxic. So it is very toxic in nature. How we can define that it is very toxic? If we talk about the medically, we give a grading system. We give a 3 grade. So I explain that. Number 1 is a grade 1 and number 2 is a grade 2. Number 3 is a grade 3. So if we talk about the grade 1 system, the grade 1 in a grade 1 system, the meconium look like a yellowish color and not is a very toxic and not is a very dangerous in nature. But if we talk about the meconium aspiration grade 2 system, so if we look aspiration, if we look green liquor, if we look at meconium aspiration in a very thick in nature and green in color, then it means that the baby is in dangerous or threatening mode. If we talk about the grading system 3, what is the meconium aspiration grade 3? In a grade 3 system, the meconium is a very thick and very full greenish in color. It means that it is a life-threatening sign. It is very most dangerous to the newborn baby inhalation process because it is very toxic in nature. They try to hold a baby airway. In this way, they block the airway and block the alveolar caps. By this way, baby goes into the death mode because the standard pressure of oxygen and is vital below down because the baby don't take a normal breath. So what is the treatment behind this? A number 1 treatment behind this, the suction should be a good. A suction is a technique in which we insert a lubricated pipe and with the help of specific pressure we sucks all the meconium aspiration which is toxic. In this way the baby airway remain or in a clear mood and baby take a breath very well. So the number 2 is the stomach wash because we know that in the stomach walls these toxins remain attached and cause a toxicity later on. So we should pass a nasogastric tube and with the help of normal saline fluid the baby's stomach should be washed. So it means that the meconium aspiration clear and baby take a breath very well. And number 3 supportive treatment is antibiotic is given. And other with the help of these 3 techniques the baby take breathe very well. When the baby take a antibiotic, when his stomach is clear, when his airway clear, then baby goes outside the life-threatening problems. So today I explain about what is a meconium aspiration, why baby the symbol baby cause a nausea, vomiting, does not take a proper feed. So with the help of meconium aspiration, these symbols are caused in a newborn baby. But after this treatment, all the toxicity is eliminated and the baby take breathe very well. So this is the whole chapter, whole method to deal with the meconium aspiration like baby. So I hope you like my video. Thank you so much for your support. Thank you always. I need your lot of support. Thank you so much. Stay safe, be blessed. Take care.